My name is Stegy Mathew, and I'm a cardiovascular technologist at NKCC Bury. Today, I'm honored to present on the role of AI in cardiology. We will explore how artificial intelligence is transforming the cardiology department, particularly in cardiovascular diagnostics, improving efficiency, accuracy, and patient outcome. My aim is to provide valuable insights into the potential of AI integration in healthcare. Thank you for your time, and let's begin.
Good morning, everyone. And that was an AI take on introducing me. Pretty good, right? Now, let me introduce myself. I'm Stegy Mathew, and today we will explore the role of AI in cardiology. From the early diagnosis to the advanced innovative treatment strategies. AI is taking over like the healthcare, heart care like never before. So let's dive deep into how AI is shaping the future of cardiology. The introduction of AI have opened up a new world of possibilities regarding remote procedures as well as complete or partial automation. The entire catheterization laboratory is undergoing a major revolution. In recent years, we have seen a remarkable improvement in the visualizing modality for analyzing and visualizing cardiovascular structures. So this is an image which showing the application of AI in different stages of intervention. So pre-intervention multimodality 3D imaging can be obtained to enable better procedure planning and understanding of procedures. So now we will go in detail some of these modalities in detail. Echocardiography, as you all know, it's a crucial modality for evaluating cardiac structure and function. However, the operator-dependent discrepancies can impact the precision of echo assessment. So AI emerged as a transformative tool in this domain which aids better visualization, better uniformization of procedures. So there's some AI algorithm that enables enhanced visualization, improved image quality. So by reducing the noise and the artifact, that aids better visualization. And also there's some validated AI algorithm that automatically calculates all the fundamental parameters. And also simultaneous apical images can also be obtained by this AI. So this is an example of simultaneous multiple apical images. In this image, in the top panel, as you can see, a single loop from an apical four-chamber view is captured. And within the machine automatically showing a apical 90-degree two-chamber at the same time. In the bottom panel, you can see a single loop is used to generate apical four-chamber, three-chamber, two-chamber, along with a 3D heart and a graph showing LV volume. So within seconds, the machine automatically calculates all the fundamental parameters with high accuracy and the results which is clearly showing on the right side. The next modality we will discuss about FFR. So FFR, as you all know, it's a gold standard method for the functional assessment of coronary arteries. So FFR-CT is a new technology. It has image-based accreditation, FDA-based. So it creates a computational fluid dynamics algorithm derived 3D model of the entire coronary tree. As we all know, CT gives a good anatomical orientation of the entire coronary tree. In addition, FFR-CT gives functional assessment as well. So this technology in the FFR-CT, we can call it as a gatekeeper to the Cath lab. And also, it may greatly reduce the need for the diagnostic Cath in the future. And multiple trials which comparing the FFR-CT along with invasive FFR showing 80% correlation. So next we will go to FFR angio. Similar to FFR CT, FFR angio uses a invasive cine run while the patient is on the table, and it automatically creates the FFR value without any need of a pressure wire. So it automatically calculates the pressure drop and VFR without the need of a pressure wire or hyperemia. And also some studies which showing between the VFFR and which is calculated using software and invasive FFR having a high linear correlation. So in future, the FFR CT and FFR angio may be more reliable than the invasive FFR. Next, we are talking about fusion imaging. Fusion imaging is a new exciting technology which combines the strength of two imaging modalities, which gives the potential to improve the procedure planning and safety. So this is an example of showing fusion imaging. The first one is a fusion of an angiographic image with CT data, so which enables better understanding of procedures like TAVI. So when we are placing the stent and all those steps, we will get a good anatomical orientation. As well as in the next image, you can see the integration of a transesophageal echo with fluoroscopy. So this enables good anatomical orientation during structural cases, as well gives us a good, better communication between the echocardiographer and the interventionist. So next we are going to the advanced imaging modalities. As I told before, cardiovascular imaging evolved tremendously over the past 2 decades. Today, imaging is crucial in both diagnosis and as a primary guidance tool for PCI. But since the stent visibility is often suboptimal using normal fluoroscopy, some digital imaging processing for stent enhancement have been developed. So, and the review of this stent enhancement shows it can be used for aortosteal lesions, bifurcation lesion, stent overlap, stent failure, etc. And it also easy to use and immediate image interpretation without any additional cost we can get. So digital imaging processing also it's good. Then we go to static vascular roadmaps. Static vascular roadmaps are used in peripheral intervention where the movement of the blood vessel is minimal. However, in coronary intervention, where the movement of the blood vessel, which prevents the overlay of static rod maps, and the navigation within the vessel, which we need additional contrast. So, dynamic coronary rod map is a game changer on this problem. So, where we can create a dynamic overlay of coronary tree on the fluoroscopy, so which we can use as a guidance during PCI. Then intravascular OCT. OCT, which as you all know, which gives a detailed visualization of atherosclerotic plaque with high resolution and automated plaque characterization. But plaque characterization is currently challenging. It's time consuming and difficult to systemize, and it's based on subjective interpretation of operatives.
1 minute per minute.
Oh, sure. So the new feature of OCT, which gives all the problems, which gives standardize and automate, co-registration, degree and maximum arc of calcification, and precise guidance on stent placement and stent length, all we can done by this IV OCT. So this is an example which showing all these things, co-registration, calcium, and also the cross-section area of the entire vessel is visualized. So this is a schematic representation of how AI is helping with the data mining in cardiology. All the integration of these data will help the physician decision-making process. Next is future. Future, it can be anything. We can't predict this can be in the future. Maybe we may predict this or any of these became our future. That's it.
Mm.